Walter, a 68-year-old retired high school teacher, always considered himself fairly healthy. He walked his dog every morning, ate homemade meals, and took pride in staying active. But for months, he had been waking up with dull headaches and feeling unusually tired after walking up the stairs. He blamed it on aging, just normal wear and tear, as he called it. Then, one morning, he collapsed in his kitchen. The doctors later told him his blood pressure had been dangerously high for a long time, he just didn't know it. The signs were there. But they were silent. Walter's story isn't rare. In fact, millions of older adults in the US are living with high blood pressure without even knowing it. It's often called the silent killer for a reason, because you can feel fine while your heart and arteries are being quietly damaged every day. Many people believe that if something were wrong, they would feel it. But that's not always how our bodies work, especially as we age. The truth is, your body often whispers before it screams. And when it comes to blood pressure, those whispers might be the only warning signs you get before a crisis strikes, like a stroke, a heart attack, or kidney failure. That's why this video matters. At ElderSpark, we're not here to scare you, we're here to help you stay informed, empowered, and ahead of problems before they become emergencies. In today's video, we're going to walk through 7 silent signs that your blood pressure may be too high. These symptoms are often overlooked or mistaken for just getting older, but ignoring them can have serious consequences. If you or someone you love is over 60, this may be one of the most important health messages you hear this year. Let's take a closer look, because recognizing just one of these signs early could protect your heart, your brain, and your independence. Why high blood pressure is so dangerous without symptoms. High blood pressure, or hypertension, is one of the most common health conditions in adults over 60. Yet despite how widespread it is, it's also one of the most misunderstood, because unlike many other illnesses, it often doesn't make you feel sick until damage has already been done. That's what makes it so dangerous. It can quietly hurt your heart, brain, kidneys, and blood vessels for years without you feeling a single thing. So what exactly is high blood pressure? Simply put, it's the force of blood pushing against your artery walls. When that pressure stays too high for too long, it begins to wear down those blood vessels. Think of it like water flowing through a garden hose. If the pressure is gentle, the hose holds up fine. But crank that pressure up day after day, and the hose starts to weaken, crack, or even burst. Your arteries are no different. Over time, high blood pressure can lead to heart attacks, strokes, kidney damage, and even vision loss. But the tricky part is, these consequences don't usually show up right away. That's why doctors often refer to hypertension as a silent killer. It creeps in, does its damage quietly, and only becomes noticeable when something serious goes wrong. As we age, the risk increases even more. Arteries naturally become stiffer over time. Our kidneys may not regulate fluid as efficiently. Hormonal changes and reduced physical activity can also contribute. The result? Your heart has to work harder to pump blood, increasing the strain on your entire circulatory system. What's even more alarming is that many seniors don't check their blood pressure regularly, especially if they're not feeling any obvious symptoms. Some assume occasional fatigue or dizziness is just part of aging, when it could be their body waving a red flag. That's why understanding the early warning signs, even the subtle, easy-to-ignore ones, is critical. These are your body's quiet attempts to tell you something isn't right. Left unchecked, the consequences can be life-altering. But the good news is that high blood pressure is manageable, and in many cases, reversible through lifestyle changes, medications, and close monitoring. At ElderSpark, we believe knowledge is power. Our goal is to help you not just live longer, but live better, with strength, confidence, and clarity. In the next section, we'll dive into 7 specific symptoms that may seem unrelated or minor, but each one could be a silent alarm bell that your blood pressure is higher than it should be. Because when it comes to your health, it's far better to be cautious early than to regret waiting too long. 1. Morning headaches, a warning sign from your brain. Do you often wake up with a dull, throbbing headache that seems to sit behind your eyes or at the back of your head? Many older adults dismiss morning headaches as poor sleep or stress. But when they become frequent, especially if they appear within the first hour of waking, they could be signaling something more serious: elevated blood pressure during the night or early morning hours. Your blood pressure doesn't stay constant throughout the day. It usually dips during sleep and rises as you wake. But in people with high blood pressure, that early morning surge can be extreme. The pressure within your blood vessels increases rapidly, sometimes to dangerous levels, putting strain on your brain's delicate blood vessels. This strain can cause the familiar pounding sensation that many mislabel as a simple tension headache. This isn't just discomfort, it's your body sounding the alarm. Morning headaches related to hypertension are often accompanied by blurred vision, nausea, or a feeling of tightness in the neck or shoulders. These aren't random. They're your brain struggling to adjust to pressure that's higher than it should be. Ignoring these headaches can be risky. Repeated exposure to high morning blood pressure spikes increases your chances of a stroke or mini-stroke, TIA, especially if left unmanaged. If you're regularly waking up with these types of headaches, take it seriously. Measure your blood pressure shortly after waking. Track it for several days. And most importantly, talk to your doctor. A small change in awareness could prevent a life-changing event. Because no headache is ever just nothing when it comes to your heart and brain. 2. Frequent nosebleeds, a tiny leak with a big message. A sudden nosebleed can feel alarming, but many seniors chalk it up to dry air, allergies, or even picking the nose. While those are common causes, recurrent or spontaneous nosebleeds, especially without clear reason, can be a subtle sign that your blood pressure is too high. Why? Because your nose contains a dense network of tiny blood vessels, many of which are very close to the surface. These vessels are delicate by nature. When blood pressure is elevated, it places excessive strain on these fragile capillaries, making them more likely to rupture, even from minor irritation. In older adults, this risk becomes even greater. Blood vessels become less elastic with age, and hypertension only adds to the pressure. That's why a person with high blood pressure may find themselves reaching for tissues more often, sometimes even waking up with blood on their pillow or shirt collar. And while one nosebleed isn't usually cause for alarm, a pattern of them is. If your nosebleeds are happening more frequently, are hard to stop, or seem to occur without explanation, they could be warning signs that something's not right beneath the surface. It's important to check your blood pressure soon after a nosebleed, ideally within the hour. Don't assume it's just dry air. If left untreated, high blood pressure that causes frequent vessel rupture in the nose may also be stressing blood vessels in the brain, heart, or kidneys. In short, if your nose keeps bleeding without reason, it's time to start listening. Because sometimes, the smallest leak reveals the biggest danger. 3. Blurred vision or floaters in your sight, when your eyes feel the pressure. Have you noticed your vision becoming a little fuzzier lately, especially in one eye? Or maybe you've started seeing strange floaters, flashing lights, or shadows drifting across your field of vision. While we often blame these changes on age or dry eyes, they could actually be warning signs that your blood pressure is silently damaging your eyes. Inside your eyes are tiny, delicate blood vessels that supply your retina, the part of your eye responsible for sending images to your brain. When blood pressure is too high, it puts direct strain on those vessels, causing them to swell, narrow, or even leak. This condition is known as hypertensive retinopathy, and it's surprisingly common in older adults with uncontrolled high blood pressure. The scary part: you may not even notice the damage until it becomes serious. What starts as slightly blurred vision or trouble focusing can escalate into blind spots, eye pain, or permanent vision loss if left untreated. One especially concerning sign is seeing sudden bursts of light or an increase in floaters. These could be signs of retinal damage or even retinal detachment, both of which require immediate attention. If you're experiencing any changes in your vision, especially alongside other symptoms like morning headaches or dizziness, get your blood pressure checked right away. Also, make sure to keep up with regular eye exams, because optometrists can often detect signs of hypertension during routine visits. Your eyes may be showing you something your heart can't say out loud. Don't ignore what you see. 4. Dizziness or feeling lightheaded when standing up. Have you ever stood up from a chair and suddenly felt dizzy or off balance, like the room shifted or your knees weakened? That momentary lightheadedness might seem harmless, or even normal as we get older, but it could be a subtle sign that your blood pressure is unstable or dangerously high. This phenomenon is known as orthostatic hypotension, and it refers to a sudden drop in blood pressure when you change positions, especially from sitting or lying down to standing. However, the underlying issue can actually be a form of blood pressure dysregulation, where your body struggles to manage fluctuations properly due to sustained high pressure in the arteries. When blood pressure is consistently high, your heart and blood vessels are working overtime. Over time, this can damage the baroreceptors, your body's internal pressure sensors, that help regulate blood flow when you move. As a result, your brain may receive less oxygenated blood during quick position changes, leading to dizziness, blurred vision, or even fainting spells. For older adults, this symptom can be particularly dangerous. A fall caused by sudden dizziness can result in broken bones, hospitalization, or loss of independence. If this sensation happens regularly, don't write it off as just getting up too fast. Start monitoring your blood pressure both when sitting and after standing. A consistent pattern of instability may be your body's way of waving a red flag. Pay attention to these brief but important moments. Because when it comes to high blood pressure, even a few seconds of dizziness can speak volumes. 5. Pounding heart or rapid heartbeat, when your heart speaks up. Have you ever been sitting quietly, perhaps reading or watching TV, and suddenly felt your heart racing or pounding without warning? Maybe it thudded in your chest like a drum, even though you hadn't moved. For many seniors, these episodes are dismissed as anxiety or aging. But in reality, they could be your heart struggling under the pressure of high blood pressure. When your blood pressure is elevated, your heart has to work harder to pump blood through narrowed or stiffened arteries. Over time, this extra effort puts enormous strain on your heart muscle, particularly the left ventricle, the chamber responsible for pushing blood throughout your body. This stress can lead to sensations like palpitations, skipped beats, or a rapid, fluttering rhythm even during rest. These aren't just uncomfortable moments. Frequent or unexplained heart pounding can indicate that your heart is becoming enlarged or overworked, increasing your risk of arrhythmias, heart failure, or stroke. It's especially important to notice if these episodes happen at night, when you're lying down, or during light activities like walking across the room. If your heart feels like it's sprinting while your body is standing still, your circulatory system is telling you something isn't right. Use a home blood pressure monitor and take note if your readings are consistently over 130/80ths of a millimeter of mercury. You might also consider a wearable device to track your pulse. Your heart may be quiet most of the time, but when it starts speaking up, don't ignore it. A racing heart could be a cry for help. 6. Shortness of breath during light activity, a hidden struggle. You take the stairs, just one flight, and suddenly you're out of breath. Or maybe a short walk to the mailbox leaves you needing to pause. While it's tempting to blame this on age or being out of shape, breathlessness during mild exertion can be a red flag that high blood pressure is interfering with your heart's ability to function properly. Here's why it happens. When blood pressure is too high, the heart has to pump against greater resistance. Over time, this can cause the heart muscle, especially the left side, to become thickened or stiff, a condition known as left ventricular hypertrophy. As this progresses, the heart becomes less efficient at moving blood, particularly during physical activity, when your body needs more oxygen. The result? You feel winded faster, even during daily routines. And while shortness of breath can be caused by other conditions like asthma or lung disease, when paired with high blood pressure, it often signals the early stages of congestive heart failure, a chronic condition where the heart can't pump well enough to meet the body's needs. What's concerning is how gradually this can sneak up on people. Many seniors slowly adapt, doing less and moving less to avoid discomfort, not realizing their cardiovascular health is declining. If you find yourself avoiding stairs, walking slower, or catching your breath more often, don't just adjust your pace, check your blood pressure. What feels like fatigue might actually be a signal that your heart is asking for help. 7. Facial flushing or heat sensation, when your face reveals the truth. Have you ever felt your face suddenly get hot, flushed, or red, especially around your cheeks or neck, without any clear reason? Maybe it happens when you're resting, not overheated, and certainly not embarrassed. Many older adults brush off these moments as just a hot flash or something I ate. But recurring facial flushing could be a silent signal that your blood pressure is running too high. Here's what's happening. When your blood pressure rises quickly or stays elevated, the small blood vessels in your face, called capillaries, can dilate under pressure, leading to visible redness, warmth, or a tingling sensation. This isn't dangerous in itself, but it could reflect a deeper issue. Your cardiovascular system is under constant strain. Unlike a temporary flush from spicy food or strong emotion, hypertension-related flushing tends to occur randomly, often during rest or without a clear trigger. It may come with other symptoms like a pounding heart, lightheadedness, or anxiety. These subtle episodes are often ignored, yet they may be your body's early warning system. In some cases, flushing can also be triggered by a sudden spike in blood pressure, known as a hypertensive surge, which can occur during stress, poor sleep, or physical exertion. These surges can silently damage your heart and brain over time. So if you're noticing this kind of facial flushing regularly, take note. Measure your blood pressure when it happens. Keep a journal. And most importantly, talk to your doctor. Because sometimes, what shows up on your face is actually coming from your heart. What to do if you notice these signs? If any of the symptoms we've covered so far feel familiar, morning headaches, nosebleeds, blurred vision, dizziness, heart palpitations, shortness of breath, or unexplained facial flushing, please don't brush them off. These are not just signs of aging. They're your body's way of waving a quiet red flag. And the most important thing you can do right now is take those signs seriously. The first step is simple but powerful: check your blood pressure at home. If you don't already own a home monitor, it's one of the smartest investments you can make for your health. Choose an automatic cuff that fits around your upper arm, and follow the instructions carefully. Take readings at the same time each day, ideally in the morning and evening, while you're calm and seated. Don't check it right after physical activity, meals, or emotional stress, as those can temporarily raise your numbers. Write down your readings in a journal or use a digital tracking app. A single high number doesn't always mean you have hypertension, but consistent readings above 130/80ths of a millimeter of mercury are worth discussing with your doctor. If your numbers are in the 140s or higher, especially with symptoms, don't wait, schedule an appointment right away. While medication may be part of your doctor's recommendation, there's a lot you can do starting today to help manage or lower your blood pressure naturally. Reduce sodium in your diet, avoid processed foods, salty snacks, and canned soups. Move more, even light walking, stretching, or chair exercises can help. Practice deep breathing or mindfulness to manage stress. Limit alcohol and caffeine, which can contribute to spikes in pressure. Get good sleep, as poor sleep quality can raise your blood pressure long term. Stay hydrated, Dehydration can impact circulation and increase your heart's workload. It's also important to communicate clearly with your healthcare provider. Don't just say "I don't feel well." Share specific symptoms and any patterns you've noticed. Mention when symptoms occur, how often, and what your readings have been. This information helps your doctor take action sooner and more effectively. The truth is, most serious complications of high blood pressure, like stroke, heart failure, kidney disease, don't come out of nowhere. The body gives hints. Small, quiet ones. But only if we're paying attention. So if any of these signs have shown up in your life, don't ignore them. Don't wait until something big forces you to listen. Because you deserve to live your later years feeling strong, steady, and in control. It's easy to overlook the small things. A mild headache. A little dizziness. A racing heart here and there. Most of us do it, especially as we get older. We chalk it up to aging, a poor night's sleep, or maybe just a busy day. But behind those normal symptoms, something serious could be unfolding quietly, and dangerously. High blood pressure doesn't shout. It whispers. And the tragedy is that too many people only realize something was wrong after it's too late, after the stroke, after the fall, after the trip to the emergency room. But it doesn't have to be that way. Your body is talking to you. The signs may be subtle, but they're not meaningless. They are invitations to act, to pay attention, to take care of yourself in a way that prevents suffering before it begins. At ElderSpark, we believe that aging should never mean living in fear. It should mean living wisely. Living intentionally. You've made it this far in life, not to ignore the signs, but to respond to them with strength and self-respect. So here's what we're asking: take the next step. If any of these signs sound familiar, check your blood pressure today. Talk to your doctor, even if you think it's probably nothing. Share this video with someone you care about. It might be the wake-up call they didn't know they needed. And most importantly, remember this: you are not powerless. Every healthy choice you make, every moment you listen to your body, is a step toward protecting your independence, your dignity, and your life. Let's not wait for the warning to become a crisis. Let's take action now, together. Because when it comes to blood pressure, what you do today can make all the difference tomorrow. Let's take a moment to recap the 7 silent signs that your blood pressure may be too high. 1. Morning headaches that feel dull or throbbing. 2. Frequent nosebleeds without a clear cause. 3. Blurred vision or floaters disrupting your sight. 4. Dizziness or lightheadedness when standing. 5. Pounding heartbeats or unexpected palpitations. 6. Shortness of breath during light activity. 7. Facial flushing or heat sensations without explanation. Each of these symptoms may seem small on their own, but together, they can paint a very different picture. They are your body's quiet signals, urging you to pay attention before something more serious happens. Don't wait until you feel worse. If any of these signs sound familiar, take your blood pressure today. Write it down. Talk to your doctor. Make the changes that support your heart, brain, and body, starting now. And if this video helped you, please consider subscribing to ElderSpark. We're here to guide you with real, respectful, and compassionate advice, because your health and peace of mind are worth protecting. Stay informed. Stay strong. You've got this.